For further information and detailed instructions on the use of the Super 7 multiple band ligator, including indications, contraindications, and warnings, please refer to the instructions for use included with the product package. Boston Scientific Corporation Microvasive Endoscopy has become a world leader in the field of interventional medical technology for gastroenterology by developing a broad product line of innovative devices to help meet the demanding requirements of gastroenterologists. This video will define and demonstrate our latest development in EVL, endoscopic variceal ligation, the Super 7 multiple band ligator. We will review the components, assembly, and disassembly of the Super 7 multiple band ligator, and then observe endoscopic footage of an actual procedure. The Super 7 multiple band ligator kit is composed of three main components: a ligating unit, a handle with tripwire and scope fastener, and an irrigation extension tube. The ligating unit is a cylinder, which is designed to fit at the distal end of the endoscope. Elastic bands are stretched around the cylinder. The pulling loop on the ligating unit is affixed to the tripwire of the handle unit during initial setup by the user. The handle unit contains a plastic spool, which turns in the clockwise direction. When the plastic spool is rotated a half turn, or 180 degrees, the handle is designed to make a distinct click sound and fire one band automatically. The handle unit also incorporates a scope fastener to secure the handle into the endoscope and an irrigation valve. To begin assembly, check that the arrow on the plastic spool of the handle unit is aligned with the arrow on the bracket. It is recommended that a diagnostic gastroscope is used. Also, a rubber grommet with the lid open. To facilitate assembly, straighten out the endoscope before you begin. Begin assembly by inserting the distal end of the tripwire through the biopsy valve, and then the working channel of the endoscope. Continue feeding the tripwire until the wire loop exits the distal end of the endoscope. Then, firmly install the stem of the handle unit onto the biopsy valve. Install the handle unit into the biopsy opening of the endoscope by wrapping the scope fastener around the endoscope and locking it into place. Attach the pulling loop of the ligating unit to the wire loop connector on the distal end of the tripwire by threading the pulling loop through the tripwire loop. Then, threading the ligating unit through the pulling loop. Next, you will attach the Super 7 multiple band ligating cap to the endoscope. Take up the slack by pulling the proximal end of the tripwire on the handle unit. The pulling loop of the ligating unit will advance into the working channel of the endoscope. Stop pulling on the tripwire when the soft proximal end of the ligating unit's cylinder contacts the distal tip of the endoscope. Notice that there is a black stripe on one side of the ligating unit. Line up the black stripe on the ligating unit with the working channel of the endoscope and slide the ligating unit over the distal end of the scope using a gentle rocking motion. Next, gently pull up on the tripwire to take up the rest of the slack. Stop applying tension when resistance occurs. Now secure the tripwire in the slot on the handle unit. To remove the ligating unit shrink wrapping, simply grasp the red tab and pull. Then peel off the protective plastic wrap. The shrink wrapping must be carefully removed by hand. Do not use scissors or other instruments, as this may disturb the bands and tripwire and negatively affect deployment performance. If irrigation is desired, attach a syringe or the irrigation tube provided. The Super 7 multiple band ligator would now be ready for use. In this section, we will review how to disassemble the Super 7 multiple band ligator. Once all bands have been deployed, unlock the scope fastener on the handle unit. Then, retract the tripwire from the working channel and remove the ligating unit. If all bands are not deployed, deploy the remaining bands into an appropriate disposal unit. Then, retract the tripwire from the working channel. Alternatively, if all bands are not deployed, unlock the tripwire on the handle unit. Remove the ligating unit from the end of the scope and cut the string with scissors. Then, retract the tripwire from the working channel. To conclude disassembly, discard the handle unit and tripwire according to hospital protocol. To begin an actual procedure, the physician introduces the endoscope with the ligating unit attached into the alimentary tract. The target varix is visualized. Then, the distal end of the endoscope with the ligating unit attached is pressed against the varix. Once complete contact is made around the varix, the suction of the endoscope is activated, drawing the varix into the housing. When a varix is suctioned completely into the housing, a readout may be observed. The handle unit is then rotated clockwise 180 degrees until an audible click is heard. A band should then be deployed, ligating the varix. Once a band is deployed, suction is released. To ligate another varix, the target is again visualized and steps 3 through 7 are repeated. This concludes the Super 7 Multiple Band Ligator training video. At Boston Scientific, we strive to improve the quality of life for patients through the development and advocacy of less invasive medical devices. Boston Scientific Corporation's Super 7 Multiple Band Ligator helps to achieve that goal by providing this new development in band ligation. For further information and detailed instructions on the use of the Super 7 Multiple Band Ligator, including indications, contraindications, and warnings, please refer to the instructions for use included with the product package.